Welcome back. It's Wednesday and we are keeping an eye on your health and we're kind of mixing things up. You come to our world all the time, so today we are in Dr. Bose's world.
Welcome to the emergency room.
Yes, now if you've ever been to the emergency room, I'm sure there's one thing that you know. You're going to wait. Be prepared to wait.
You're going to wait a long time, and that's frustrating for many patients. So in this segment, I want to explain why people are waiting so long, because it is very frustrating for the people waiting here.
Right.
So first of all, when you come to the emergency room, you end up checking in, and you come in through triage. So triage basically means prioritization. So we need to triage our patients. So in the emergency room, it's not always first come, first serve. It's sickest come, first serve. So if you come in here with an ankle sprain, for example, you may be the first one here, but if someone else comes in with crushing chest pain that is worrisome for a heart attack, they're going to be bumped in line in front of you. So that may be one reason where they may be here for something that is not quite as urgent and can be seen in an urgent care setting or in a primary care setting, and they end up waiting quite a bit of time. So as we move here, then the patients are put into a room. Then you come here, and this is the world of electronic health records. So this is how we work in the emergency department. We have a computer system, and patients often get frustrated because it looks like the nurses and doctors are just sitting around and chatting, but that's definitely not the case.
Not the case at all.
I mean,
it's the opposite.
You know, as long as we're sitting here, it's very, very stressful from the provider's end. So for multiple reasons. Let's take, for example, ordering an aspirin. So when you look across the country at most of these health record, electronic health records, an aspirin will usually take about 6 clicks on this mouse. So to order a simple aspirin, you need to click this mouse 6 times, according to this data from 2013. Now, let's take someone with right upper quadrant belly pain. So the right upper segment of their belly hurts. For an average 10-hour shift, we're talking about 3,200 to 4,000 clicks on a mouse.
Wow.
So
the other side to it is the staffing.
The staffing is a big part of it too. Across the entire country, there's a nursing shortage. If you look here across the emergency room, you know, this is our nursing segment, and you see there's no nurses sitting here right now. And this is not a problem, you know, at one hospital. This is a problem nationwide. So, you know, when you see that nurse, and that nurse is probably working for several nurses and doing the job of several nurses and probably the job of several techs as well. So this is often frustrating for the patients, and I think it's important to see behind the scenes what is going on.
This is what's happening. You're clicking. Everybody's busy working. Other people's doing, you know, multiple things at once.
Right, and this is in a climate of short staffing. This is in a climate where the electronic health records are taking over, and you know, our biggest concern is patient care and making sure that, you know, our patients are treated well. And unfortunately, to treat patients in the best possible manner, sometimes you actually have to be in and out of that room with the patient quickly. So you actually, unfortunately, have to cut the time you're talking to your patient so that you can take care of all the patients and do the mandatory treatments required and make the mandatory phone calls for that patient. So
the biggest thing to take home is just don't go to the hospital to begin with. Stay out.
The biggest thing is what you want to do. The biggest take-home point here is you want to avoid the hospital if possible. Stay healthy, eat right, exercise, make regular appointments at your primary care doctor. It's kind of like servicing your car. If you take it in every year to get serviced, you service yourself every year at your primary doctor, you don't break down and end up having to go for an emergency reason and get frustrated. So, we apologize about the wait. You know, it's unfortunately a part of any primary care or emergency department setting right now, but I'm glad to have you guys here to share with you what's going on behind the scenes.
Thanks for having us.
All right.
We're going to take a break. We'll be right back.